This slide presentation is about dissociative disorders. So this is dissociative identity disorders and a couple other dissociative disorders that are found in the DSM-5. What they have in common is they often occur after a significant event has happened in the person's life or with a history of trauma. The individual responds to the stress with an interruption of their consciousness. This is a defense mechanism to protect them from whatever that stressor was, and the anxiety that goes along with that. So there's an emotional separation where the brain protects the person from whatever these memories or experiences were. Going to talk about 3 different types: depersonalization or derealization disorder, dissociative amnesia, and dissociative identity disorder. What these disorders have in common is the fact that there is a onset of problems with memory and concentration and awareness related to either a traumatic event currently or something that has happened in their past. A lot of people who have problems with this also have another mental health diagnosis, often depression, PTSD, and possibly schizophrenia. Reasons for these disorders, there are psychological factors to them, maybe environmental, and there are some cultural considerations to think about with these disorders. Some cultures, this is not as uncommon as it may be in the normal American culture that most of us kind of live by. So the first of these disorders is the depersonalization, derealization disorder. Depersonalization focused on self, feeling disconnected from your body and your thoughts. And then derealization is feeling as if you are looking at yourself from outside your body and things around you just aren't real. So the focus is on the outside world. Depersonalization is on the inside, the self. Dissociative amnesia is it's a rare event, and this is when you forget your own personal information. It is usually because of a traumatic event. This can last from a few minutes. It can last for years. Also, a dissociative fugue is kind of a subcategory of this, where there's trauma and they forget what has happened to them, and then all of a sudden they are purposely traveling or wandering, although they do not remember their own personal information. Every once in a while you see someone who's turned up in another state, doesn't know who they are or why they've come where they are. And usually there's some kind of trauma that has happened that has sent them this way. Treatment for dissociative amnesia and the dissociative fugue include CBT, psychotherapy, creative therapy using the arts, and then possibly hypnosis. Dissociative identity disorder is the presence of two or more distinct personalities, at least two. The alternate personality or alter has its own memories, its own thinking, its own life, really. The person, the main person may have no idea that this is going on. Usually this is a severe trauma, and childhood sexual abuse is very common in people who have dissociative identity disorder. This is a diagnosis that is controversial. Some experts don't even think that it exists, that it's more of a personality disorder, while others do believe that although it is extremely rare, these disorders affect 1% of males and 2% of females in the population, so a very few number of people. So there is some controversy about this. The video that's in your module this week kind of talks a little bit more about that. This is one of those disorders that's become very popular with social media, and if you go to YouTube, you can see people who are willing to show you their different personalities, and they can switch from one to the other effortlessly and tell you all about each other. That is not usually how it works. Usually the main person is not aware of the alternate personalities, at least in the beginning. They start having symptoms of losing time, finding people that know them, that they have no idea who they are, maybe missing appointments and not realizing where the time went. So they just lose time and can't explain it. Maybe they see things in their home that they didn't buy, don't know how they got there. So one of the things that they do, the goal is to integrate the personalities so that everyone is aware of everyone else. And once they start some psychotherapy, they often have the person write in a journal. So each personality can like leave a message for the other personalities so that they kind of know what's going on with them. Psychotherapy is the main treatment for this disorder. Medications are used to treat the symptoms. Again, people with this disorder may have other mental health issues also. Assessment for these disorders, we want to know their history. Any moods, do they have mood changes? Are they depressed? Are they anxious? What's the impact on the family and the patient of this dissociation? And is there a suicide risk there? And then what does the patient think about this? What's their perception of what's going on with them? So these are the phases of treatment for dissociative disorders. The first phase, making sure the person is safe, stable, and reducing the symptoms that are associated with this. Then phase 2 is confronting and working through what is behind the dissociation, and then working on those memories to make sure that everyone has the same memories, all these personalities. And the third phase is to integrate them so everyone is integrated into one personality. That would be the main person's personality. And so the alters aren't needed anymore because the person is able to handle those memories and deal with them themselves, and they don't need that defense mechanism of the alternate personalities anymore. This slide just shows some of the interventions, some that I've already talked about. Um, the education, pharmacological, and then CBT, some psychotherapy, exposure therapy, uh, EMDR, that's the eye movement therapy that's used for PTSD, hypnosis, feedback, ego state therapies, somatic therapies, and medications to treat symptoms. Please watch the video. It's another one that is very helpful to kind of help you understand the disorders themselves.